Joe Tillman, welcome back to another episode.
Glad to be back. How are
Yes,
you?
I'm doing good. I'm doing
Very good.
good. I'm actually really excited to talk, so quite a few things on my mind.
Awesome.
Um,
Let's do it.
yes,
Let's
so
jump
for
in.
those who don't know Joe Tillman is a 23-year veteran of the hair loss and hair restoration industry. He started out as a patient in the early 1990s and was the unfortunate recipient of two failed and badly performed hair transplants. In early 2002, he received his first high quality hair restoration surgery as a repair patient and was instantly hooked on learning the finer details of what separates great surgery from not so great surgery. Joe went on to become the face of one of the most recognized hair restoration clinics in the world, Hassan and Wong, in Vancouver, British Columbia, Canada, and has since gone on to become an independent clinical advisor working with close to 20 doctors worldwide, where he advises them on how to better manage patient expectations and the overall patient experience. He also operates a successful YouTube channel where he shares unbiased information to educate the average person suffering from hair loss and who wishes to learn about their hair restoration options.
More or
Joe,
less.
what's up, brother?
Not a whole lot, man. Just living the dream, you know?
That's great. Well, let's jump right into it.
Yeah.
Um, So first and foremost, I don't stop now that more active on TikTok. I don't stop seeing those Turkish hair transplants
Yeah.
and those patients and
The
whatnot.
algorithm knows, man. It's feeding you.
Yeah, yeah. So actually, I want to start with this. Someone asked me the other day. They're saying, and I actually get this request a little more often than normal, but people ask me saying, "Hey, I'm on finasteride. I'm taking my 5% minoxidil every day. I've been doing so for 5, 6 years. What do I recommend as the next steps?" And the first thing they talk about is keeps, it's Hims, it's
Hmm.
Happy Head. It's for those who don't know, there are these companies that are propping up, putting a whole bunch of stuff into little concoctions, topical and some
Hmm.
oral stuff. And a lot of people who don't necessarily know much about the industry are jumping right on it. So I
Yeah.
want to know, Joe, what would you recommend to someone who's been taking the conventional stuff for so long and they're looking for next steps?
Well, it depends on what their conventional steps are. If they're taking uh, finasteride and minoxidil, um, my first question to them would be, well, tell me more about those, because we live in an era now where when someone says I'm taking finasteride and minoxidil, it doesn't mean the same thing if someone else says it 5 minutes later in a different conversation. And what I mean by that is how, and you just touched on that, how things have been changing in the pharmaceutical space, where there's so many people coming into the space where they're offering those two options, and they're all generic. And this is something I've spoken about. We may have touched on this in our last conversation, but this is something I've spoken about for almost 20 years now. Ever since the generic version of Propecia became available. And I learned, unfortunately, through, I don't want to say trial and error, but through the experience of patients I was working with, that generics are not the same across the board. Um, a lot of, I'll call it anecdotal research since then, has confirmed that that's the case, in addition to speaking with professionals in the pharmaceutical industry, where they have actually criticized uh, pharmacies for not themselves understanding that there's a difference between, um, one generic to the next, and what it means to be quote unquote bioequivalent when it comes to generics being compared to the original source formula, or the source pharmaceutical itself, in this case being Propecia with the active ingredient finasteride. So that's kind of a long-winded
No, it's necessary.
lead up. But the problem is, when people say finasteride, it can mean one of, in North America alone, I think it can mean one of different, I forgot the number, up to 20 different manufacturers of generic. So that to me is a problem that I recognized a long time ago, because, and I'll give a small backstory on this. I had a patient calling me 2006, 2007 from Southern California, and the classic line, "My Propecia stopped working," was what he said to me. And I was like, well, how does that even happen? It doesn't just stop working. It's not like there's a switch that's flipped and it turns off. So long story short, we had our discussion and I was going through all the different possibilities I could possibly think of. Like I wasn't really used to hearing that claim or that problem. And I asked the one question that actually led me down this rabbit hole even further was, did you change the source of your medication? And that was just out of nowhere that I came up with that question. And he said, yes. Really? Okay. So he explained to me that he had been going to his brick and mortar pharmacy. It might have been Walgreens or CVS or whatever at the time.
Was he on a name brand originally, or was he on a
No,
generic?
that's just it. In fact, he wasn't even on Propecia. He was on the original Proscar. Which your audience may not realize is the original form of finasteride. Originally came out as a prostate medication for benign prostate hyperplasia, and the side effect was hair growth. Fast forward a few years, and we have official Propecia. It is the same thing, literally.
Just to clarify one quick thing, Joe.
Yeah.
So yeah, the Proscar is 5 milligrams,
Yes,
and
correct.
the Propecia is the 1 milligram. But
Correct.
what many people do, and they're both. Well, if you get the name brand, it's both from the company Merck, and I think now it's been kind of transferred over to a parent company.
Or Organon.
Organon.
They spun off a new company called Organon. And I think that the headquarters is in Italy, if I'm not mistaken. And it could have, and I don't know the details on that. It could have been merged with a legitimate generic manufacturer, and they just handed them the whole recipe. And I don't know the details of that. I just know that it's been spun off into a different company.
Right. And it's just a really quickly, and the point here I want to make here is that even a lot of times people who want to get on the best quality, the name brand, what they buy is the Proscar. It's cheaper. Sometimes it's cheaper to buy the 5 milligram, break it up into 4 pieces.
Right.
And you take 1.25 milligrams rather than just taking the 1 milligram Propecia prescribed specifically.
And that's the way I always recommended it, where dollar for dollar, it's the same price, or at least it was for a very long time. But because it's 5 milligrams versus 1, you're effectively, and most people generally just quarter it. So you're effectively reducing your cost by 75%. But to get back to that point, he said he had changed the source where it was a brick and mortar, like a regular pharmacy you'll walk into and pick up the prescription. And he switched it out to an online pharmacy. And again, this is like maybe 2006. So that was a pretty new phenomenon in the internet world where you could actually buy medication online. And it just happened to be a pharmacy where the number indicated it was in a place called Surrey, British Columbia, which is 25 minutes, depending on traffic, away from my home. And he's in Southern California. So it's like, oh, wow, okay, small world. And they were pulling it in from India and then drop shipping it, or maybe directly shipping it, I don't know, to whomever was ordering it. So I recommended that he throw it in the trash, go back to his brick and mortar pharmacy and renew his prescription for name brand Proscar at the time, and call me in 6 months. He did that, and he did that. And he said, my hair's back. I'm not losing my hair anymore. It's thickened up anymore. So that was my first big clue. And then I went down the rabbit hole of a lot more research and talked to a lot more professionals that know a lot more than I do. And it was confirmed, even in a 60 Minutes piece several years back, they're talking about Lipitor. I believe it was Lipitor. Which is a cardiac medication. And they're finding the same thing with that, the name brand versus the generics. Generics just aren't, in many cases, in some cases they are, but in many cases they're not up to snuff. They can't compare to the original. And it was explained to me by one pharmacist who he actually owned several pharmacies, a small chain, and he explained it to me. He said, yeah, you're absolutely right, because I asked him about this, and he said, when you look at, and it was Lipitor, coincidentally, he said, when you look at Lipitor, they have, I think he said 33 patents in their formulation. The requirement to call a generic the bioequivalent and to be able to be sold legitimately by pharmacies as a generic version of Lipitor was 13 of those patents had to be met as far as
any arbitrary 13, or is there?
In that specific instance. for that specific medication in
Right.
Canada anyway. I
Right,
don't know
but
about the US.
was it like these 13 are fundamental and have to be
I
implemented, or it's like pick any 13 as long as
Right.
you hit
No,
13?
I don't know. I don't know the
Okay,
question to that, or the answer to that
right.
question. That's a great question, actually. But I think it was actually 36 in the original, and then they had to meet. It was a little bit less than half of the number of patents. I forgot the specifics, but it was certainly a far cry from being the exact same thing, but as a generic. So there's a lot to that. Like there's a whole underworld in
And
the
it's so
pharmaceutical industry
granular,
that deals with that.
and your average person has no idea what any of this is. They go
No,
to their
a lot of
doctor.
pharmacies don't. That's the thing. You walk into a pharmacy and you start asking them about this. What's the difference between, insert name brand here, whatever it may be, and the generic equivalent? What's the difference? And they will tell you straight up, there is no difference. It's just
Right.
cheaper.
Exactly. And the doctor wouldn't even bring this up. He'll just write you a prescription. He'll go,
Yeah.
"Oh, it's cheaper. Get the generic. It's the same
Yeah.
thing."
Yeah.
That's
Exactly.
literally like what they would tell you every time.
Yeah.
And it's not the same thing. It never
I
is.
I personally believe that a lot of the ailments that we're seeing, not just hair loss, but a lot of the ailments that we're seeing, there's being treated by medication. A lot of people are not being successful in their treatment because they are using generics.
Right.
Some are. I mean, absolutely, there are a lot of generics, and probably most generics are at least perceptibly so, as effective as the original. But I'm convinced that there are a lot of people out there that are not getting the care they need because they're not using the right medication, even though they're told that they are.
Right. And just for a little macro perspective here for the listeners, the thing about it, there's nothing particularly special about the name brand, but what makes the name brand something that we trust is because that is precisely the structure that went through rigorous optimization in clinical trials.
Exactly.
And the problem is when you deviate by that, even by the slightest, you don't know what you're breaking. And it's not even just the active ingredients. It can even be the non-active ingredients can help the delivery structure. So deviating from that whatsoever can give you a wildly different experience. And what you want is stability and predictability. So when you get a
100%.
generic, even if that generic does work for you, the pharmacy will give you another random generic based on what they have access to. So you're actually going to be getting different medication likely every time you go to refill. And even if 80% of the generics work, you have this element of unpredictability now. And when you get off the drug, and if you take something that's not really working for you, it's like you're kind of going off the drug for a month or two. And that is
Yep.
something you really don't ever want to do.
Yeah, and
No.
and I've had that situation with the original patient I was just talking about. That scenario has been replicated countless times since then in my career, where I'm talking to someone like that's the first question I ask now when someone says, "Well, my medication doesn't seem to be as effective as it used to be." I ask them, "Were you taking generic?" And tell me about the history with that, because even going from one generic to another can actually cause the same degradation in results.
And it can also shock your hair. It can
Yeah,
cause
yeah,
telogen effluvium. It can do all sorts of stuff.
100%, 100%. So,
Yeah.
I mean, it's a big deal. I've talked about it many times, reactively and proactively in various discussions and sometimes on a lot of times on the show, The Bald Truth every Friday. And so back to your original question, what I recommend is I would recommend examining your medication. Like, are you taking name brand versus generic? And if you are taking generic and it seems to be working for you, make sure you note the name of the manufacturer. And anytime you go in to get your refill, look to see if it's the same manufacturer. And if it's not, ask for that brand again. They can order it for you. They'll just tell you, well, we don't have it in stock. It'll be a few days and it may cost more than what we can charge you now. But if you want it, we can order it.
Exactly.
That's usually the case. So your audience needs to understand that in any situation, if the medication they want from the manufacturer they want is not available, it can usually be ordered unless something dramatic has happened. So that's something to keep in mind. That'd be the first thing I talk about.
And tying this back into the bigger question of, hey, everyone who's dealing with hair loss now, who does not necessarily engrossed in the industry, is coming across Hims, Keeps,
Oh
Happy
yeah.
Head. And honestly, the idea is pretty cool. So, you have to go to the store to get your Rogaine 5%. You have to go get your finasteride. And then you have these companies that are saying, hey, I'll take care of all that for you. I'll ship it to your house.
Yep.
I won't even give you 5% minoxidil. I'll actually get a pharmaceutical compound and get you 7, 8%
Mm-hmm.
minoxidil, which is a lot stronger. And for those who don't know, the finasteride is the active ingredient, is the chemical, the molecular name for Proscar or Propecia.
Mm-hmm.
Now, their finasteride is blocking one of those enzymes that produce DHT, and you have a more potent drug called dutasteride, which blocks both of those enzymes. And then you have companies like Happy Head that are actually putting that in their concoction. So it's way stronger. So in a way, it's kind of cool. You're getting customized medication that's really good, but at the same time, like Joe just mentioned, like you just mentioned, you're getting generics now.
Yep.
And they're not going to tell you what pharmacy that's compounding them. That's proprietary. That's private information.
Yep.
You're just going to have to trust, and also based on where you are, what they do is once you make an order, they ship it to a pharmacy. They ship the message. The pharmacy gets a ping saying we have an order. They make the compound and then they mail it out to you. So chances are you are getting variation, and you have to hope that you're doing it correctly. But the other side of this is, although you're right, people are seeing really good results from doing all this. So it's kind of a weird position to be in. But if you can find a way to get these compounds customized on your own from pharmacy, great. But I want to know your opinion. I mean, at the end of the day, given what you've described about the issue with generics, do you still strongly recommend that you just keep it simple and get the basics? Or
Yes. Yes, I'm a big believer in keeping things simple, because when you start adding more variables to the equation, it's harder to keep track of what's going on.
Right.
And I'm not even a fan of these combination compounds. I prefer individual, because you can track things better if you have a finasteride, if you have a minoxidil, if you have a dutasteride. Some people take all three. If you have your saw palmetto, if you all these things, you can quantify which is which in the greater experience if it's individually accountable. If you look in each one and say, okay, what can I subtract or add to my regimen based on whatever factor you want to base it on? You can do that. You can't do it if it's all compounded into one pill or one gel cap. So
and to add to what you're saying, you can also take each of those 6 months apart, and you can say, hey, this is really working for me. Because the problem now is when you take these concoctions like you're describing, and one thing is working, or hey, my hair's looking good, which is great news, but now you're stuck taking all these things, and some of these things can have harmful effects and not giving you any of the benefits.
That's why I've always told people, don't start everything at once. Like before the multi-pharmaceutical compounding into one pill, people would say, well, I'm going to start my laser cap, I'm going to start my finasteride, my minoxidil, my PRP, all of this in the same week as it comes in from shipping. I'm going to start it. I'm like, no, no. If you do all this at once, you got two things will happen. One, you have a huge probability of going through a massive telogen effluvium, a massive hair shed, because one, or God forbid, all of those will shock your system at the same time, and it can shock your hair into the state of shedding, telogen effluvium, and you won't know which one is actually responsible for that. But then two, if you got wild success, and you alluded to this earlier, 6 months later, you don't know which one's responsible, so you are stuck taking all of those elements. And who the hell wants to experiment by taking one away to see if that's safe? It's like, no, like that. Correct. No, that's the antithesis of the whole approach to begin with. You want to have the best outcome possible, and you don't want to risk it by experimenting with things, taking them away. So back to the original question, what do I recommend? I recommend keep it simple, keep it trackable, so you know what you're taking, and be patient with the changes. Make one change and don't change anything else for at least 6 months, so you can see if there's some sort of benefit or detriment to the routine. But when it comes to the specific medications, if we're assuming that they're taking finasteride and minoxidil, I will ask the question, well, which format? Is it topical or oral finasteride, or is it topical or oral minoxidil? Because now we got both for both medications, and including with dutasteride as well. And if they tell me that they're taking topical minoxidil, the next step I would recommend is to maybe try oral minoxidil, because I'm seeing like the evidence is, I don't want to say it's overwhelming, but it is certainly backed up with
Very,
with
very
clinical
positive.
studies
Yes.
by various independent specialists in the field that deal with minoxidil on a regular basis.
Right.
That it is more effective than topical.
Yeah, and one thing
vastly more so.
Right, and one thing to quickly add to that is we all have to keep in mind that there's nothing that will fundamentally replace your DHT blockers.
Correct.
So if you're not taking a DHT blocker like finasteride or dutasteride, you're really looking at very temporary just salvaging of your hair when you take stuff like minoxidil. But now people taking oral minoxidil, I think it's called Lonitin. Keeping one thing in mind, you're going to grow hair everywhere on your body, not just where you apply it.
Yeah.
But the good part is it's easier to remove hair than it is to grow hair. If
100%.
something does both, it's worth doing it.
100%.
Now, that's a very good point. So if someone's taking the oral, you'd recommend the topical, and if someone's taking the topical, you'd recommend the oral, even though it's the same molecule, you're just changing how you're delivering it to your body, and you can have profoundly different effects or beneficial effects.
I would not recommend going to topical from oral unless they're having some sort of problem with the oral. I'm a believer in the oral compound being far more effective than the topical.
But you would recommend even adding it, as in doing both, right? So if you're taking, for example, finasteride, you're taking Propecia, and you're saying, hey, I want to kind of up it a bit, you'd say, hey, why now add it, take the topical as well.
I would, if they're only taking finasteride, Proscar, Propecia, whatever, and they want to add something to the mix, before adding a new treatment, I would suggest upping their existing treatment from 1 milligram to maybe 1.25 or even 2.5. If it's already working for them, then the experiment is only if more will work better.
Correct. And that was actually my question, specifically with finasteride.
Yeah.
Someone's start with the 1, you go to 1.25, and then you hit the 2.5. I know that everyone is different, but in your anecdotal experience, when would you say at some point is really the increased probability of the side effects and the diminishing effects? At what point do you say it's just not worth taking it, upping your dosage any further?
Well, I think it's worth saying it's not worth upping your dosage anymore.
I mean, at what point? Would it be like 5 milligrams, 10?
Well, I mean, I know people have taken 7.5 successfully and for many years with no downside and only upside. They brought it back down themselves only because they were starting to question the long term. Is this safe for me? It's like, we don't know what 20, 30 years of 1 milligram will do. Well, we have a pretty good idea now.
But 5 milligrams, anything more than 5 milligrams is more than that was FDA approved even for BPH.
Exactly. Yeah. 5 milligram is the max FDA approval, and that's for benign prostate hyperplasia. So I think even 5 milligram is on the high end of what I think is realistic, but at the same time, that's fine. Just don't go any higher than that, and not for any specific reason. Like, people could go for 10 milligrams and it could be fine. I have no idea. It's just, we know, and we don't know if there's a point of diminishing returns with dosage, because in my career, I have seen strong evidence that indicates it is dose dependent, where I've seen patients that on 1 milligram, it's not working really at all, go to 2.5 or 5 milligram, and it does work fine. There is a visible aesthetic improvement. And I've had people that have been on 5 milligram for 10 years, and the doctor said it's not necessary, just stick with 1 milligram, and they did so, and they lost all their hair. Like, it was shocking. And going back to, and one patient in mind that I'm thinking of, they went back to 5 milligram for 6 months, no change, had to go to dutasteride, and everything came back. Like, I mean,
it's all very weird. Yeah.
Very weird. Maybe logical if you dig down and think about it, but overall, yeah, I mean, it's crazy how different people react in different ways to the same medication, or the same person reacts to the same medication at different dosages, where other people, I mean, there's really no rhyme or reason in many cases of how people react to it. So, yeah, if anything, your listeners should understand at this point, if they didn't know already, it can be quite complicated. And again, that's why I believe in the simplicity of medication. Don't overcomplicate things. I believe in starting out with finasteride. I don't believe in starting out with minoxidil or dutasteride. Finasteride is the gold standard. I think it's more predictable. We know more about it than we do the other two treatments, and use that as the baseline for everything else. Get on finasteride, monitor how you're doing on it for a year, 6 months bare minimum, but usually I think a year is solid, and then make your decision there. Are you seeing benefits from the finasteride? Then I think sticking to it is fine, because we know that the efficacy curve goes on for up to 24 months. So stick it out for another year and look for the additional benefits. And keep in mind, this is a marathon. It's not a sprint. So, if you're impatient, it's like, it's not doing enough. Has it plateaued? We don't know. So stick with it, have some patience. And then if you believe it has plateaued, then you can start exploring alternatives to add to it, not to replace it. And that's where I think oral minoxidil comes in as more of a sure bet as opposed to topical. And when it comes to finasteride topical, I think that's warranted as a secondary option only if the side effects from going systemic with oral medication is just too much to bear. And that's the whole reason why we have topical to begin with. It's not because it's any better than oral. There's anything out there that's saying that's the case is heavily skewed in favor of the manufacturer that commissioned that study. And that's why it's there. I mean, I was there for the formulation of one of the first ones available before Hims, before Keeps. And that was the whole reason. It was recognized that there's a market for something that could be effective, not expected to be as effective, but with the trade-off is less likely of incident of side effects.
Right.
That's the whole point of the market.
Yeah, and it's important to note, just for listeners, and also obviously, neither of us are doctors, so speak to your doctor for anything. But
yeah,
one thing that is important to notice is that the side effect profile for minoxidil, oral or topical, seems to be pretty minimal. So that's something where people who are a little sensitive to the side effects of finasteride, often it's it's not a replacement, but it does help to consider minoxidil and even upping your dosages on minoxidil, because again, that the risk benefit equation is a little more of an area to experiment with, as opposed to something like finasteride.
Yeah.
And I want to jump into just the next question here, because I had a friend of mine. I looked at my friend. I said, "Hey, your hair looks really good. Like, have you changed something?" He goes, "Yes, I just changed one thing." And I want to ask you this, because I know that, obviously you and Spencer are your own people, but you do have a little more of a still philosophical common ground on a lot of stuff. And I know that Spencer is vehemently against doing microneedling. And when I asked my friend what he did that change, and I said, "Your hair looks much better," he said, "All I do now is I added microneedling for 3 months." And I wanted to get your opinion on that.
I'm not totally against it, because obviously there are cases out there where they're few and far in between. But for the most part, I think it's a massive waste of time. And the reason why I'm not 100% in that square is because I've seen really crude and anecdotal evidence on my own person, where I've seen where wounding causes hair growth that wasn't ever even there to begin with. It's really bizarre. The example is when I was biking on my road bike.
But hair would never grow on scar tissue. And the whole idea is that this stuff causes micro scars.
Well, that's actually a different argument. Okay. But in my case, where I scraped my knee badly from falling off my bike. I was biking through the city, and I wiped out and really badly scraped my knee. It took several weeks for it to heal, but when it did, and that was 4 years ago, I think, when it did, I noticed hair growing in that patch on my knee, right below my kneecap. And it was like thick, not thick like on my head, but thicker than all the hair around it, and thicker than anything that's ever grown in that spot. Like it's really bizarre. Like,
did it go away?
No, it's still there. It's still there.
That is very weird.
I know.
And
But
it sounds very counterintuitive too.
it is counterintuitive.
But you should have no hair there, anywhere there's cuts or scars or damage.
Yeah, and the wound, I mean, the scar tissue, there's really no visible scar tissue to speak of. So while it was a pretty bad scrape, it was very superficial, kind of in line with what we get with microneedling, but it was much more abrasive than any microneedling. Well, I can't say any. I've seen some cases online where, someone took the adage of bigger, better, stronger, more, will get us the result we want faster. And he microneedled the shit out of his forehead to where it was profusely bleeding. Like it looked like
crazy.
It looked like birdshot. Yeah, it was crazy. But as far as the idea of micro scarring, I don't believe that when we're microneedling that is causing micro scarring. I believe that
at what length are you talking? Like 0.25 millimeters, 0.5?
The standard, 1 mil, 0.5 to 1 mil. I don't believe that's causing scarring per se or micro scarring per se, because the wounding is so minor that scar formation doesn't have a chance to occur.
Right.
You do have actual skin regrowing in that area because you do have stem cells rushing in to remodel the wounding. Scarring occurs when there's not enough material to rebuild it into skin tissue. It's a replacement tissue, so to speak. But even scar tissue can grow hair. I mean, that's a whole different discussion. But back to my point is I don't believe that it's microscarring per se unless it's too frequent, unless it's once a day or even multiple times a week, and it's more abrasive than it should be. So,
but most importantly, you're just on your end. It sounds like, from what I take from what you're saying, it's not the benefits aren't really there, and the risks and the unknowns are a little too high.
I think that it's, the cases that we see or hear about online where there is some sort of, success, however that's defined by the end user. I think that because more people are talking about it, there's more people trying it, and we will see more cases of success. But I think that the ratio of success versus failure is roughly the same as it ever was. It's just, it's all relative as far as the number of people trying it. So,
right. And a lot of these people who are trying it are probably trying something else as well, and they're crediting the mic, because sometimes these TikTok people or people who are not necessarily versed in the industry, they're hearing hair loss, they take their finasteride, and 2-3 weeks later they jump on their microneedling and they go, hey, look, it's working.
I think there's some of that too.
Yeah.
But I think there's also a huge discrepancy from one person to the next and how they're doing it. Because
right.
I'll be honest with you, I was surprised when I had a PRP session with one of the doctors I work with, Dr. Jerry Cooley in Charlotte, North Carolina, and he's recognized as one of the guys in the field that knows his stuff about regenerative medicine. He's one of the, I don't like using the word pioneer, but he is one of the people that came up with a lot of the protocols that are used by most clinics today. And even before he got into hair transplant surgery, when he was doing his residency at Johns Hopkins University, his specialty or his focus was cloning. Like, that's his background. And so when he's talking about regenerative medicine, PRP, or the other modalities out there, he knows what he's talking about more than most people. But the problem is, no matter how much you know about this particular subcategory of hair restoration, it's still anecdotal because there's no large scale studies on any of this. So, I take his word based on his gut instinct on what he's seeing in his clinic, not based on, 500 participants in some study, because who has the money to fund that to begin with? So I'm deviating a little bit, but I had PRP with him 9 years ago. 2016, when I was in his clinic for a visit, just to check out his clinic. We were starting to work together, and it's like, well, I need to check out your facilities, make sure you're up to snuff. And of course he is. And I had my PRP, and then part of the post-treatment protocol afterwards was microneedling. So they did a microneedling session on me, and then they gave me the roller and said, do this once a week for the next few weeks, and just to help to stimulate the growth. And I understand the logic behind that, because when you're wounding, stem cells rush to the area. They've already introduced a protocol that can kind of direct that remodeling into potential hair growth, because he was also using A-cell, which is another ingredient in his PRP formulation at the time. And that microneedling was different than the microneedling I had at a different clinic. I won't go into who they were or what the treatment was, but it was similar to a PRP treatment. Experimental for me. I was like, they just told me about it, and I thought about it. I understood the basics of it. It was like, sure, let's give it a shot. And they did a microneedling session on site to help administer the treatment. And it was completely different than what I had experienced with Dr. Cooley's office and their microneedling treatment. So my point about this is, even microneedling, same stamp or roller or whatever, can be completely different from one patient to the next based on how they're told to do it. Deeper, more shallow, harder, softer. That in and of itself can be a major component in the overall success or failure of that protocol for the patient. So my point is, there's no standardized approach to any of this, be it microneedling, be it exosomes, be it PRP. We have no standards with surgery from one clinic to the next. So we can't expect surgery, non-surgical modalities to be standardized either.
Very interesting.
And they're not. So
yeah, it's a lack of protocol. It's a double-edged sword. Protocols allow you to get really good data, but they can also stifle innovation and creativity. So it's that back and forth. But,
I agree with that. And to speak to something you were mentioning earlier, you mentioned one of the brands of the back on the mail-in pharmaceuticals. You mentioned Happy Head, and full disclosure, the people that started Happy Head, or one of the doctors that started Happy Head, is one of my clients, Dr. Sean Bainham in Los Angeles. I have nothing to do with his medication business. We've talked about it. Like I did have questions about it. One of the differences that I know between his formulation and the way that he runs things versus, I won't name names, but
others,
larger well-known brands, is he does have protocols in place for quality assurance, and all of his ingredients are sourced in the United States.
That's good. That's great to hear.
That's something that's important to me. I've been approached by some of these companies to work with them on not just their branding, but also to be, kind of like a representative or a spokesperson for their brand. And one thing that I asked is, well, can you, I'll sign whatever you need me to sign, but can you show me that you have controls in place to make sure that your ingredients are what they say they are and where they're supposed to be coming from? And only 2 companies that I've spoken to have said that they do that. And one was Happy Head, whom I've not discussed any sort of deals with. So there's no undue influence here as far as, what to buy. I get no benefit from that. And there's another one. It's not nationwide yet. It is available in the Southwest, Texas and Oklahoma and that region. And that is, I think it's called Forme,
How do you spell that?
Forme, with an accent grave on the end. It looks like For Me.
Mm-hmm.
And it may not be the name of it yet. I may have let something slip, but it's the formulation from Dr. Joseph Yaker in Dallas, who is also a client of mine or a doctor I work with. So full disclosure on that. I also get nothing from mentioning that. I've never been asked to talk about it. I get nothing for talking about it. But he
what was his
too
name
also scratch that name. Just remember Dr. Joseph Yaker.
Joseph Yaker, got it.
Yeah, and that's Yaker. He's in Dallas, Texas. Both of those doctors have their formulations where they insist on their medicate or the ingredients of their formulations being sourced in the United States. It's not coming from China in bulk. It's not coming from India in bulk or any other country that's outside of North America. Maybe some of it's Canadian. I don't know, but it is North American. I'll say that.
Very cool. All right. Joe Tillman, I think we're running out of time here, and I know you said you had a strict time of 8, so we're a little bit past that. But it's always amazing talking to you. You're a wealth of endless knowledge, and
I'm a source of nonstop talking. At least I can say that.
and it's truly appreciated.
Yeah, well, it's
the more
fun.
you talk, the better. Yes, I agree.
Yeah, it's fun, and we should do this again because I'm sure you had some more questions, and there's so much more to talk about.
We do, and there's always the next time.
Yeah, right on.
Enjoy your day, Joe.
All right.
Thank you for your time.
You too, buddy. Thanks.